Hello and welcome to today's tutorials where we are going to interpret the ECG. Now, in a stepwise approach, we are going to assess the rhythm, calculate the heart rate, as well as assess the cardiac axis of the ECG. Then we shall review individual waveform in this series. So, when we say rhythm, what we mean is the sequence with which the heart is beating as a result of the generation of impulses running through it. And so this rhythm may be either regular or irregular. What do I mean by this? A regular rhythm is when the intervals between the R waves are almost equal or are regular. What do I mean by this? Now, if you look at the diagram on your right, this will be our first R wave, then this will be the second R wave, then another R wave. Now, we measure the distance between the first R wave and the second R wave, as well as the third R wave. And as we can see, we count 1, 2, 3, 4 big boxes between the R and R interval over here. And we count the same number of boxes between the second R and the third R. And so we say this rhythm is regular. Sometimes, however, we may find, some little variations in this interval. And so when we measure and we find, a variation of less than 1.5 small boxes, still we consider this to be a regular, rhythm. Now, what do I mean by irregular rhythm? By irregular, we mean that the interval between the R and R, waves are not equal, as you can see on this diagram. So this being our first R, our second R, you can see even from just looking at it that the distance between the first R and the second R is different from the distance between the second R and the third R, as you can see over here. So over here we can count 1, 2, 3, big boxes between the first R and the second, but we can count 1, 2, 3, 4 boxes between the second R and the third R. And even more so, when we compare the third R to the fourth R, we see that the distance or the interval between them is so wide. And so we say this rhythm is an irregular rhythm. And like I said before, there may be simple variations in them. And so even if you measure and there is more than 1.5 small boxes more between the R and R interval, we still say this is an irregular rhythm. Now, moving on, we must, measure the rhythm of the ECG using the standard lead 2, because it gives us a prolonged recording as well as a good view of the P wave. And so anytime we are assessing the rhythm of the ECG, what we usually look for is the presence of a P wave over here. So as you can see, this is the P wave of the ECG. And so we assess whether a P wave precedes any of the Qrs complex. So over here we have one Q wave over here. We have another one also over here. Then another one also over here. Anytime we find P waves preceding the Qrs complexes, we say this is a sinus rhythm. It is sinus because the impulses are originating from the sinoatrial node. Then it conducts through, the rest of the bundled branches to the ventricles to cause it to contract. And so, whenever there is absence of a P wave preceding the Qrs complex, we say this is a non-sinus rhythm, meaning the impulses are not originating from the sinoatrial node. And so this may be pointing towards any of the arrhythmias. This is important because sometimes impulses may generate from sources other than the sinusoidal node, and it may, prompt further investigations for us to do. Now, the irregular rhythms have other forms. It may either be regularly irregular or irregularly irregular. What do I mean by this? If you look at this diagram, the first ECG is a regular rhythm because the interval between the R and R are the same throughout this ECG. But if you look at the second ECG, you realize that there is a repeated pattern of irregularity, even though we have, regular intervals in it. So we have the ECG starts as a regular, pattern, then we have an irregular pattern following it. And so we say this is regularly irregular, rhythm. If you look at the last one, we rather find a completely disorganized, presence of Qrs complexes throughout the rhythm strip. And so we say this is an irregularly irregular rhythm because from the beginning it wasn't, regular throughout. So it is irregularly irregular. So this is how we assess the rhythm of the ECG. In our next tutorial, we shall be looking at how to determine the heart rate of the ECG. Thank you very much for your attention.